Okay. A lot of familiar faces here, so let's just jump into it. I assume everybody sees the screen. Um, click here. Okay. So imagine you're waking up in a hospital after a stroke. Your life has changed. Your body and mind, they don't work as you did before. You start inpatient rehab to regain lost functionality, then continue rehab in an outpatient clinic. But eventually, you're told you are plateaued. And these have to be the most terrifying words that a stroke survivor can hear, because it means that no matter how much or how little your condition is improved, your current state is as good as you'll ever get. And for over 90% of stroke survivors, the outcome doesn't allow them resuming an active, independent life. Let me give an example. Meet Bryce. Bryce was a chiropractor, a thriving business, and active life. That is until his stroke in 2021, which caused him to lose function in the right side of his body. Couldn't speak, had no idea where he was or what had happened to him. And after a period of rehab, Bryce recovered partial use of the right side limbs. Now he could walk with assistance, but was certainly not considered mobile. He was able to speak, but only the words yes, no, and hey. And this was the state at which Bryce was declared plateaued. Now, there are 8 million stroke survivors in the US, each with a story like Bryce. Most are living with severe impairments and have given up on further treatment. Now, despite medical advancements, why are these survivors still struggling? Well, most recovery happens during the inpatient rehabilitation at the hospital. The next step is outpatient rehab, though patients are often told not to expect further improvement in that phase. You see, the current neurorehabilitation approach is a one-on-one coaching from a therapist while performing some variation of modality-specific repetition exercise. Now, Torque3 takes a very different approach. First, we stimulate general neuroplastics through a full-body multimodal experience that works the entire body along with all of the senses and cognitive functions. This saturates the sensory, association, and motor cortices with signals. And next, we trigger neural remapping through continually novel and challenging task-oriented effort, which is associated with the perception of risk through our deeply immersive simulation. And finally, we compensate for neuromuscular weakness through advanced robotics, so the patient doesn't even feel they're impaired. Now, we've conducted 2 8-week functional tests with 6 participants, all previously declared plateau. Let's see how Bryce, one of our participants, responded. So, despite being plateaued initially, Bryce made some significant improvements. By the end, he walked with better balance, confidence, and more importantly, without an assistant. He formed simple sentences and smiled. He and his wife had a noticeable better outlook. And the other 5 participants also showed similar progress and continued improving as the test cycles ended. And I'd like to highlight just a couple of them. Natalie, who had cerebral palsy, showed similar improvements to the stroke participants, demonstrating that our approach benefits various neurological conditions. Other participants with brain damage from a tumor also improved significantly during the test. Peter, another stroke survivor, experienced profound improvement. He started with a walker and finished without even needing a cane. So with these results, our long-term goal for the platform is to tap into a new market, treating disabled stroke survivors who have been declared plateau. We've already taken 3 crucial steps to minimize product risk. We developed a proof of concept prototype to validate the feasibility of the immersive simulation system and tested neuroimpaired patients' VR tolerance. We completed the challenging technological development of a robotic assisted innovation, including asymmetrical compensation. And we successfully concluded safety, function, and efficacy testing, demonstrating significant improvements I just told you about. Now, moving forward, we'll refine our customer fit, expand nationwide, and pursue our long-term goal. Our first step is to open an inaugural partner clinic here in Salt Lake City. Next, we'll expand by opening 20 partner clinics across the US to build the brand and gather the patient data at scale. We'll use that data to complete research and lobby for a plateaued patient CPT code. Finally, using that code, we'll open up the massive plateaued market and even add product as a service sales. Now, why this go-to-market strategy? Well, we've considered hospitals that have rehab facilities and existing clinics. Each have pros and cons, but neither offers an ideal path to market. Hospital stays are still too brief for getting the full benefits from our approach, and rehab clinics would be resistant to changing their treatment paradigm. Now, while both of those channels would contribute to long-term growth, we need a more effective path for our launch. And the key questions for Torque3 include market demand for this growth and responses from existing competitors. And regarding the market demand, we have a sizable addressable market with 8 million stroke survivors in the US alone. And while our focus is on stroke survivors, our system can also treat other neurological conditions like traumatic brain injuries, dementia, and Parkinson's disease. And each partner clinic would only require about 120 patients annually to achieve revenue and profit goals. So across the initial 20 clinics, that totals about 2,400 patients yearly, which is a small fraction of the current target population and even less than 1% of the annual increase in new patients. This leaves significant room for growth for partner clinics and future product as a service launches. Now, our market share growth will not impact existing manufacturers. Unlike our multimodal approach, their products are modality specific, like the Locomat for gait training and the Armio for arm therapy they've shown in the images. Now, initially, Torque3's focus on partner clinics avoids direct competition with these manufacturers for the current customers. And because there are over 44,000 physical therapy clinics in the US, adding 20 partner clinics will not significantly impact this market. But more importantly, those existing clinics concentrate on the 800,000 new stroke patients, not the 7 million who have been plateaued. Our partner clinics not only don't threaten existing providers, but also have the potential to expand the served market by up to tenfold. We'll open a blue ocean market space, a niche in which the unmet customer need is where we are the only ones offering an effective solution. And remember, this market with private pay is substantial, but with a new CPT code for plateaued stroke survivors, it's poised to expand exponentially. And this positions us to potentially open a new $90 billion market with Torque3 as the sole company servicing it. Now, I'm proud to say that Torque3 has assembled a great team to make this happen. I'm the founder and CEO, a veteran of 3 previous ventures. Nevin's my chief technology officer, an expert in simulation technology, and previously has developed a host of deeply immersive platforms. Nevin and I have been working together for over 20 years. Tim is my chief science officer and expert in neuroscience. Tim previously served as the director of the neurobehavior program at Walter Reed Medical Center. Tim and I have been working together for about 5 years. The 3 of us brought together neuroscience and deeply immersive technology to create the Torque3 platform. The remaining members of the team, including executive board members and medical advisors, all have expertise in the areas necessary to commercialize the platform, get it to market, and grow a successful business. The focus of our plan is treatment for stroke survivors in the US, but there are other avenues of growth for the platform as well. The global stroke survivor population is over 10 times larger in the US with similar challenges. Neurorehabilitation, as I mentioned, extends beyond stroke to other neurological conditions, all with our approach that can address. Now, alongside our primary growth strategy, we'll opportunistically explore inquiries beyond our core focus. These may include licensing, design and support services, platform sales, or even the product and service arrangements. For instance, we've secured a $6 million license deal with a US autism treatment company, and we have an initial agreement with Intermountain Healthcare for a 12-month in-clinic trial. Now, we anticipate all these avenues will contribute to Torque3's long-term growth, because in our vision for Torque3, there are no plateaus. Currently, Torque3 is offering a SAFE with a post-money valuation cap of $15 million for preferred stock, a discount rate of 80%. Minimum investment is $50K. So far, we've raised $150K of the $500 goal. Funds from this round will provide bridge capital as we sign up our partner clinics and move to close the Series A funding. And then we can leave the animation up and running or kill it however you want to do it, really, during Q&A.
Okay. All right. Thanks, David. Let's see. Gary?
David, good to see you.
Good to see you again, Gary.
I've heard your presentation, although it's evolved quite a bit since the last time we spoke. I have to say that I like the new model of the clinics and actually delivering it, from the source, as opposed to trying to kind of sell it to or have it be used in an enterprise level environment. I don't really have much in the way of questions. I know pretty much about the model. I guess I'm more intrigued about the new business model. of the clinics and the growth that you see, over the next 24 months. You're not raising a whole lot of money considering, I mean, you've got the device built and you've put all the research into it. I know that. So it seems to me you would need more money than that to accomplish what you're trying to achieve. So maybe if you could elucidate,
Sure. Yeah. And
elaborate on that.
That's a phenomenal question. It illustrates exactly where we are. So honestly, on Monday of this week, we started our outreach program for our partner clinic program, which essentially allows other peoples to fund other investment in these small groups to put in 500, anywhere from about, I say, 600 to 1.7 million dollars, depending on the size of clinic they want to open, into operating and owning a clinic and collecting all the profits. This is our initial expansion. Having those out there is a massive valuation driver, right? Being out there with these clinics and building the brand and collecting that data. Going to a Series A would be we're very close, but it's just a tad premature. So 500,000 is just enough to bridge us, to get us out there, and they're fairly self-sustaining. I mean, that amount of money coming in from each of these clinic deals, partner clinic deals, is going to be fairly self-sustaining for the company.